Today on 21st Century Television.
Explore state-of-the-art technology, innovative business strategies, insights from cutting-edge corporations around the globe. A visionary look into the answers of tomorrow, today. Business leaders, business solutions.
21st Century Television.
Welcome to 21st Century Television. I'm Jackie Bales. In today's medical world, new treatment options and research data are being put forth at an unprecedented rate. For physicians with busy schedules, keeping up with these advances and maintaining the necessary credentials to keep their licenses can be a real challenge. Well, here today to explain how they're helping physicians overcome this challenge, we have Medical Director Dr. Jim Epstein and Vice President of Strategic Accreditation Services, Christopher Bolwell from Imedex. Welcome, gentlemen.
Thanks, Jackie. Good to be here.
Thank you very much, Jackie. Good to be here as well.
Jim, first of all, why is ongoing education for physicians and healthcare providers so important, and what challenges does it pose for them?
Well, Jackie, we deal primarily with the disciplines of hematology, oncology, gastroenterology, and hepatitis. And these are all areas in which there has been a virtual explosion of knowledge and information in the science of the disorders and in the molecular and cellular mechanisms behind the diseases. So it is really imperative that physicians keep up to date on what's going on in these fields and the data that is going to impact their patient management and hopefully the outcomes for their patients. So it's really very important that physicians find the time to participate in educational activities, and it's our goal to provide them with those educational opportunities that can be presented in a timely manner, in a concise, efficient, unbiased, and targeted format. And so this is really the challenges we meet to try to achieve those goals to help physicians with their educational needs and fill their educational gaps.
Chris, give us a little more background on Imedex, the company, and share a little more how you're able to help physicians and healthcare providers keep up to date with all this new information.
Yes, well, Imedex has been in business, the accredited education business, for 25 years now. And we really aim to distill down the difficult data that exists out there into a much more practical, hands-on, how can this affect your current treatment of your patients. So we're trying to install into physicians, this is how the data is interpreted by experts, and this is how you can bring it to your practice and change how you treat patients.
Well, in today's 21st Century Television Field Report, we take an inside look at Imedex and their learning solutions in action.
While physicians are required to participate in educational activities on a regular basis to maintain their license to practice, the time out of their practice means a reduction in potential salary. Beyond that, there are many educational opportunities available. Finding the right one can be time-consuming and further impact the practice. Imedex is uniquely positioned to deliver relevant, impactful, and practice-changing educational content to a large audience of healthcare providers with the ultimate goal of improving patient lives.
Imedex provides experience and creativity and really can help a company like ours deliver a program from the very beginning when we talk about needs assessment to the very end in terms of looking both at accreditation for CME and measuring outcomes. And by providing all of this in a very exceptional way, it's an obvious partner for us in our programs.
All Imedex activities and programs are designed to gather valuable feedback. Doing so allows Imedex to continually focus on the measurement and improvement of the education being offered to their target audience. Imedex provides a unique value proposition which includes world-class educational content, positive participant experience, strong educational reach, and an expanded portfolio of capabilities and services.
Every physician has a different way of learning, so I think what really also makes Imedex unique is its ability to choose different vehicles to deliver education. So if they know there's a market for community physicians or nurse practitioners or physician assistants, the way people learn, they'll go after different vehicles. So if it's a WebEx, if it's a teleconference, if it's a monograph series, if it's an animated type series of education, and live meetings. And this meeting here at Advances in Florida really speaks to the size of their commitment also to the field of inflammatory bowel disease, but as well recognizing that live meetings are still a critical part of the way people learn.
Imedex works hard to continually improve their accredited medical education. This commitment to internal excellence enables them to continually offer relevant, impactful, and practice-changing educational content to physicians seeking the best in continued education.
It's a really great concept for the physicians. Jim, what would you say is your approach to education?
Well, Jackie, I was in practice in community oncology for 30 years, and so I think I have a fairly good idea as to how important continuing medical education is to the practicing physician. And my goal is to try to provide the latest information coming out of clinical trials, expert forums, national and international meetings, and then synthesizing that down to an easily digestible and understandable program so that when a physician completes an Imedex educational program, they come away with the knowledge and hopefully the skills to go home and alter their practice patterns, change their management of patients for the better, and improve patient outcomes.
Because otherwise, to expect a physician to go through the reams of data and make decisions on how they should handle their work, it just seems an impossible challenge.
It is. It's absolutely. The amount of data coming out is phenomenal, and we really try to provide them with the expert perspectives on how significant is this data, how it's going to impact patients and their management of those patients, and how they should integrate that data into their practice.
So Chris, in your opinion, what is an effective educational program or activity?
Well, initially it has to be relevant to them. So they have to be able to understand how it's going to help them treat their patients, and obviously see that it is going to be a benefit to them. It has to be unbiased because promotional activities are very different, and they can see a promotional activity when they see one. And ours has to be completely trying to help them into treating their patients better. And then finally, it has to be impactful. They have to know what they have to do. They have to be able to, as Jim said, we distill it down so that they really know how it's going to impact their patients and what they need to do.
So it needs to be clear.
Yes, yeah, very much so.
How do you measure effectiveness, Jim?
Well, ideally, Jackie, we would like to go into every practice and see how the information we've provided has actually affected patient management and patient outcomes, but privacy laws make that somewhat of a challenge. So we do try and strive to demonstrate that we are satisfying at least 4 of the main outcome measurements: participation, satisfaction, learning, and competency. So we test our participants before they participate in the activity, at the end of the activity, and then we go back to them 3 months later.
Oh, wow.
And see how much they've learned, how much they've retained, and hopefully how much that knowledge has changed the way they're managing their patients and demonstrating that they have achieved a higher level of competency.
And do you find that that is the case?
It is. It's amazing. I think if you produce an engaging program and you get people involved and interacting in the program, they will retain a much higher percentage of the knowledge. And with many of our live meetings, we make the webcast available online. There are downloadable slide sets so they can go back and reinforce the knowledge that they've gained, and hopefully it will make a real change and be better for patients' lives overall.
Wow. Well, it really sounds like the education solutions you're creating at Imedex are helping to make the complicated lives of physicians a little bit easier, as well as, expanding that knowledge. Thank you both for coming on the show.
Well, thank you, Jackie.
No, thank you very much.
For 21st Century Television, I'm Jackie Bales. Thanks for watching.